Welcome everyone to the first webinar of this 2018-2019 fiscal year, titled Using Evidence-Based Therapies to Support Tobacco Cessation, an Overview of CBT and Mindfulness. So our faculty presenters today are Stephanie Kersta and Carolyn. If you just want to say hi.
Hi.
So as always, I'm just going to go through some basic housekeeping and then I'll have them take it away. So I do see a lot of new names in our participant list, so that's awesome. Welcome. If it is your first time attending one of our webinars, please note that these webinars are accredited by both the College of Family Physicians of Canada as well as the Royal College of Physicians and Surgeons of Canada. So if you are interested in obtaining a letter of completion, please ensure that 1, you have registered for this webinar and completed the pre-learning assessment. You're signed in right now to view the webinar using your first and last name, because that's how we're going to track your participation. And then finally, after the webinar, I'll be sending out a link to complete an evaluation and post-learning assessment. And you'll have 1 week to complete that. So remember that these webinars are being live tweeted on Twitter. So you can follow the CAMH Nicotine Dependence Service using the @PSQuitSmoking, as well as the hashtag #TeachWebinar. So here are our faculty bios. Stephanie holds a Master's of Science in Psychology, as well as a number of certifications and certificates in addictions and mental health counseling, solution-focused therapy, cognitive-behavioral therapy, and psychometric assessments. And Carolyn is a clinical social worker with a specialization in mental health and addictions, and she currently works on the emergency crisis teams at both Toronto Western and Trillium Mississauga Hospital. So these slides will be sent out after the session, so you can read more about them at that time. Here are their disclosures, as well as our disclosures. And remember that these slides were developed using funding from the Ministry of Health and Long-Term Care and are based on evidence-based guidelines from the following sources. Remember that these materials and other materials provided and the verbal presentation and any discussion set out only general principles and approaches to assessment, and they do not replace the need for individualized clinical assessments and treatment plans by a healthcare professional. Okay, and finally, just sort of to gauge who's joined us here today, we're just going to do some quick polling sessions, and then I'll have Carolyn and Stephanie take it away. So, please, using the following radio buttons, just indicate which one of the following that you work for. Okay, so seeing a lot of people from public units, family health teams, and hospitals. Awesome. Okay. And then again, please indicate which of the following disciplines you work in. And you may just need to scroll down to see the entire list. Okay, so a lot of registered nurses. Yeah, and if it's not on here, you can always type it in the chat. So we have an educator, consultant, some health promoters, respiratory therapists. Awesome. And last question. Please indicate which region your organization serves. And again, if it's not on here, maybe you're from out of province, you can type it in the chat as well. Alberta. Nice. Worldwide, Saskatchewan. Wonderful. It's nice. It's always nice to see when there are people from outside of Ontario, too. That's great.
Oh, New York. Cool.
I am hearing a little bit of feedback, so just before we begin, if your line isn't muted, could you just press star 1 to mute your line, just so then there's no feedback. Thank you. Okay, and with that, I will have the two of you take it away. Thanks.
Awesome. Thank you. And thank you for having us. And welcome, everybody. So thanks all for joining in. My name is Carolyn, and I'll just kind of give maybe a quick little introduction into just for both who Stephanie and I are, and then we'll get into the webinar today. We were together for about an hour. So again, my name is Carolyn. I'm a clinical social worker. In terms of, and actually maybe I'll introduce Stephanie at the same time because we have very similar bios. Both of us did undergraduate degrees in psychology. We both did some postgraduate training in addictions and mental health, and both of us went on and did our master's degrees, myself in social work and Stephanie in psychology. And we both kind of work in a variety of disciplines now, teaching at quite a few places, a couple of universities and colleges, as well as here at CAMH in their TEACH program. And we also both have a clinical private practice as well, and that's where we really draw on a lot of the CBT principles and techniques that we're going to be talking about today through the next hour. But aside from our private work that we do, we also have our own company. It's called Ease, and this sort of a little bit, I guess I'll let them know. So, because it's relevant to the training today, is we've actually are opening up a meditation and mindfulness studio in the city of Toronto at the end of this summer. And I bring that up, one is because we're trying to bring out mindfulness a little bit more to making it accessible to everybody, but also really building on a lot of the clinical research that supports the use of meditation and mindfulness, not only to help with mental health and addictions, but even overall wellness. And that's something that we are really passionate about, is health promotion and wellness promotion. So it's exciting that we're starting that, but that we're also able to talk today about some of those strategies and mindfulness principles. Both of us are firm believers in things like self-care, and I'm a yoga instructor myself. I don't really teach a lot of yoga. I completed my training more so that I could bring in some of that work into the clinical sessions that I do with clients. And Stephanie does quite a bit of work in meditation and mindfulness. And we'll talk a little bit about today of how we kind of weave in these meditation and holistic practices into some of the clinical work that we do with our clients.
Cool. So just quickly go over the agenda today. So we've introduced ourselves, and we're really just going to do an overview of CBT, or Cognitive-Behavioural Therapy, and have lots of discussion and practice, and then also talk about mindfulness and meditation and a lot of the science behind that. And lastly, we're going to kind of encourage you to do some take-home activities to be able to actually utilize some of the things that we talked about in today's session at home. So we love when we keep an eye on the chat box, and we love hearing from people, so type away.
So I'll just kind of give you a little bit of a brief introduction into what CBT is. Many of you have probably heard of the theory. It's called Cognitive-Behavioural Therapy, Cognitive Behavioral Theory, and it's something that we use quite a lot in clinical practice as clinicians in the therapy work that we do. And then there's lots of different ways of taking kind of CBT. We can kind of do really intensive CBT, but also a lot of the clinicians that we know sort of weave in techniques and principles of CBT theory into sort of just their day-to-day interactions with their clients. So this is sort of the CBT model in kind of a visual form. So the idea is really that our mood sort of influences thoughts, which influence kind of our mood and emotions and our behaviors. So again, looking at this visual here, it's my mood and emotions influence my thoughts and actions. And you can see then the arrows of how they're all linked together. And so then in turn, your thoughts and actions can influence the quality of your life, And then the quality of your life ultimately influences your mood and emotions. And so that's really sort of the CBT theory, I think, in a brief way, is to really show the interconnectedness of thoughts or cognitions, emotions, and feelings, and ultimately our behaviors. And so again, this is just to sort of highlight how linked that they are. And I think many of us probably know this. When we sort of get stuck in a negative mindset, it ultimately influences how we feel, right? And so oftentimes with the clients that I work with, it's about pulling out these thoughts, really, and looking at them in an objective way and sort of saying, if I'm thinking this way, how must I be feeling? And if I'm feeling this way, what are my thoughts like? And I know that, again, with myself, too. When you get in a negative frame of mind, it's really hard to sort of feel happy or feel motivated or feel encouraged to go do something or tackle something when your thoughts are kind of in a negative space. And then that ultimately then, of course, if I'm feeling down and I'm feeling low or I'm feeling sad, the last thing I'm going to want to do is kind of get up and work on a particular goal that I have. And then if I'm not acting on those goals or not achieving those goals, then I feel stuck. And so many times we see our clients are stuck kind of in that spiral, right, in that negativity spiral, that negative feelings, and then ultimately that lack of action or that inaction. And so again, this is just building on some of the major points of cognitive behavioral therapy. And again, we just want to give a brief overview on some of the major kind of principles, and then we will work into some of the strategies and ultimately how it relates to nicotine dependence and how we can apply that in the work that we're all doing. So again, emotional disorders, from a CBT perspective, we really see it as the result of this faulty information processing. So it really looks at the brain, and it looks at the way that we process information, the way that we categorize information, and the way in which we sort of view life. And so, again, we know that with CBT, it's all about collaboration and collaborative discovery. So it's working together with your clients. And I think that's something we talk about very often in the TEACH program, is sort of this client-centered approach and partnerships and collaboration with your clients. And CBT really is that. It's about working with your clients to sort of pull out these cognitions, pull out these feelings, and be able to look at them and challenge them in a really therapeutic way, but also a little bit more objectively as well. And then we'll look at how people are interpreting things, how that leads to their own emotional reactions. Schema is sort of a word that we kind of use very often in CBT, and that's really sort of the cognitive structures that automatically sort of organize and give meaning to information that we take in. It's sort of essentially the way that we categorize how we see the world.
Filing system.
It's our filing system. Yeah. That's a good way of putting it. And we often will talk about something called automatic thoughts. And automatic thoughts, I think, are things that many of us can relate to. That's what your mind kind of says automatically when you're about to do something, or if you're thinking about something. Like I have clients, the second that they have to do a presentation or have a project or something in school, right away their brain goes to this negative, I'm going to fail, I'm going to embarrass myself, and that's their automatic thought, right? They come to that thought before they've even really given much
focus
further,
to it.
reflection on it. So part of CBT is getting people to sort of slow down. And what are these automatic thoughts, right? If every time you have to give a presentation, your brain goes right to how you're going to fail and it's going to be the worst presentation that you've ever given, that ultimately is going to affect how you feel about presentation, and likely you're probably going to avoid doing some work on that project or whatever it might be. So we'll start to see that. And then we also see something, we're going to explore these as we go through today, but there's something called cognitive distortions. And I still don't love the terminology.
No, either.
But we call them distortions, or they also call them thinking errors.
Or faulty thinking patterns.
Faulty thinking patterns. I feel like that there should be another
fallacies.
Yeah, there should be another way to refer to them.
But these are nicer.
Yeah. But these are sort of ways in which people view the world and how they can kind of affect us. And we'll go through and we'll break down a few of them, so I bet they'll make a little bit better sense as we move through the presentation.
So often with the cognitive or the automatic thoughts, what I hear from clients all the time is that they have these automatic thoughts and they call them like the rabbit hole, you know, because one leads to another, which leads to another, which leads to another. And, you know, they were feeling okay. And then after 4 or 5 of this kind of negative spiral or this downward spiral, they notice how much their behavior has, or not their behaviors, but their feelings or their emotions has decreased.
Mm-hmm. So, I mean, the main concept. So again, this is just this is kind of looking at how we may apply some of the concepts in a therapy session. So really, it's about taking in that information. So again, working collaboratively, finding data about client patterns of thinking, identifying environmental events that might activate these beliefs. And again, we'll start to apply them to things like addictions and particularly quitting smoking, but starting to be able to pull out sort of what are some of their thoughts around that, right? Asking the clients when they think about things like quitting or when they think about wanting to stop smoking or make a goal when it comes to smoking or tobacco cessation, what are some of those thoughts, right? What are they actually saying to themselves in their brain, or that self-talk? And then we might actually start to try things, like behavioral experiments in the form of like homework assignments. Homework is something that is very big
Part of it.
Yeah, very essential in CBT work, because then we start to encourage clients in our sessions to start to challenge these beliefs, because ultimately, most of the time, these beliefs are rooted in perception, the client's own perception and interpretation, not reality. And that's often a question I will pose to my clients sometimes, right? Do you think it's the way that you're interpreting the situation, or is this sort of the reality of the situation? And we use that to test, to see how it is in the real world when they challenge those thoughts. It's very kind of scientific, I think, in nature.
So one of the techniques that we use with CBT is guided discovery. And it's kind of, like Carolyn said, it's kind of very scientific in nature. It really is this problem-solving game. So instead of just kind of answering the question, we oftentimes will encourage our client to think deeper and to kind of delve deeper into their own answer. So if a client were to say something like, I feel so depressed today, you know, we're going to answer that with some questions, like, when were you first aware of feeling depressed? What was happening at the time? What were the thoughts you had when you started feeling depressed? And really this allows the client, and it really empowers the client to be able to arrive at their own understanding of the thoughts and beliefs that affect their emotional state. And it allows them to better start to see kind of the linkages between their thoughts and their emotions. So we have a little activity that we were hoping we could just kind of utilize the text box for. If you guys can, think about if you've ever heard the term cognitive distortions, or if you're aware of any cognitive distortions, if you want to just type it into the chat box. We just want to know kind of how many that you're already aware of, and if you want to kind of go a little bit further, what cognitive distortion are you aware of, and kind of what does it mean? So we'll give you a couple minutes to just do that. 3.
Black and white thinking.
A lot of people know black and white thinking,
Yeah.
all or nothing. If I do badly at X, then I'm a failure all around.
Yeah. That's very all or nothing kind of thinking. Minimization, magnification.
Making assumptions versus facts. Ordered eating.
Perfectionism, labeling. Catastrophizing, that's a big one.
It's a big one, super common.
Yeah, overgeneralizing, over-exaggeration.
Should statements. It's my favorite one.
Oh, I like that. Horribilizing. I like that. Like a catastrophizing.
I know, I love that.
Yeah. That's awesome. Belief perhaps becomes a thief. A thief belief.
jumping to conclusions, personalizing everything. Great.
Really good one.
Yeah, really great one. So these are the most common thinking distortions, and I think we'll just kind of spend a little bit of time going over some of them.
Mm-hmm.
Yeah.
I often joke, I saw kind of mind reading comes up there, and I often will joke, I work with a lot of adolescent clients in my private clinical practice, and we sometimes will joke that I have a whole bunch of fortune tellers and mind readers as my clients, because many times they do, and that's something that we really work on with CBT, is this idea of mind reading. So many times with the younger clients that I work with, there's a lot of fear of judgment or negative judgment from other people. And so they'll tell me, I know that so-and-so was thinking bad about me, or I knew, when I had to give that presentation, the teacher was staring at me and I knew what the teacher was thinking. And it's really interesting because they say it with such conviction, but yet, again, we're making an assumption that we know what someone is thinking, right? We can't get into the heads of anybody else. And so that's something that I often will therapeutically challenge with my clients. And then the other one is being a fortune teller, right? It's being able to feel like you can look into the future and already know how it's going to go, and already know it's going to be really bad and really negative oftentimes. And so therefore, why would I do it? Why bother setting a goal if I already know I'm going to fail? And so that's something, again, that I challenge, because none of us know, or at least I haven't met yet a fortune teller, a true fortune teller. So I, again, joke with my clients. I said, I haven't met a real one, I don't think yet. So, but it's, again, therapeutically challenging those kind of beliefs that they're having, right? And that's, again, what CBT is all about. So those are two that I often come across in my practice.
I find catastrophizing so often, and it's always really interesting because I work with a lot of individuals who are in university or doing master's programs or young professionals, and oftentimes a lot of the catastrophes are related to grades or, getting fired from their jobs. And we'll talk about certain kind of events and the catastrophe around it. And oftentimes, it is such a catastrophe when they think about, if this is going to happen, it's the worst, right? It's not only that, they'll make a mistake at work, but it will be a mistake for like the CEO of the company, and they'll lose the company millions of dollars, and then they'll get fired, and then they'll lose their house, and then they'll lose their partner, and it becomes this big catastrophe, which obviously is very upsetting for clients. And so when I think about the flip side, are we trying to challenge it and look at the other side of things? I'm like, well, what happens if you do something really great and, the CEO notices, and, the chances, or kind of the percentages around kind of the actuality of both of those things happening could be 50-50. And so it's looking at things more objectively rather than kind of thinking through that catastrophe and just kind of assuming that the catastrophe is going to happen.
Absolutely. Yeah, I think another one I see quite a lot, I think, is that all or nothing thinking, right? You're either sort of amazing at something or you're awful at something, and you kind of disqualify the positive. Again, many clients that I work with, if they get 80% on a test or 8 out of 10, many of them will disqualify the 8 marks that they got correct and will focus on those 2 marks that they lost, and then really magnify that in terms of, I didn't get those 2 marks. Again, using cognitive reframes, and that's something that we'll talk about, we'll start to shift people into being able to see that, hey, you did very well, you got 80%. I also see that sometimes with the all or nothing thinking in business as well, sort of, especially around things like abstinence. And so when people sort of make a slip, especially like, let's say it's smoking or drinking, and then, they have that little bit, it's like, well, now all of my sobriety is gone, and then it sort of can trigger a binge, because not recognizing that, sometimes there is a middle ground, and the slip doesn't always necessarily mean a relapse or a full binge. And so that's something I see as well, right? Just because you had that one piece of cake doesn't mean that now you're like, well, I have to have the whole cake because I failed. You had a slip. And so that's something as well, is to encourage, is that all or nothing thinking. And I always tell my clients there's a whole bunch of gray area, there's a whole bunch of middle ground, and it doesn't always need to be the 2 extremes.
Yeah, the 2 polar opposites, right?
Yeah.
I see should and must thinking quite a bit too. And it's really interesting because people will oftentimes, have all these rules for themselves, and they'll say like, I should be doing this, I should be doing that, or I must be doing this, or I must be doing that. And what that does for a lot of people is it creates a lot of guilt for them. And that guilt is what really can impact some of those emotions. So it's not only changing the language, but it's also kind of seeing where that, I call it shoulding, seeing where all that shoulding comes from and the impact that it's having on one's thought process.
That's the big therapy joke.
Yeah.
Don't should yourself.
Don't should yourself. I think we're good for that. Any questions about the thinking distortions? We're keeping an eye on the chat box too. So if we think about kind of best practices with CBT, CBT really is the gold standard in the field. It really is well recognized and well researched. There's a lot of empirical support for the efficacy of CBT. And so Health Canada does suggest CBT, considering it the best therapy for not only concurrent disorders, but also for substance use disorders as well. We also see it as kind of the first line of defense for anxiety, and it's used quite often for mood disorders as well. Just keep an eye on the chat box. Perfect.
So how do we really structure a CBT session? And again, this will really vary depending on sort of your level of training in CBT, but also depending on the time that you have with your client and what it is that you're focusing on. It can really lend itself well, though, to brief interactions with clients. I know oftentimes I'll utilize some techniques and strategies, but I don't necessarily always do like a full kind of CBT structured session.
Agree.
But generally, it'll look at sort of starting the session, introducing what the session will look like. So I often will explain a little bit about what CBT is to my clients. Mainly how I describe it is that we're going to be focusing on the cognitions or thoughts that might influence the way that you feel and ultimately your behaviors and how they're all interconnected. And that I always tell them I like to take out kind of what is going on in here, that inner dialogue, and pull it out in a way that we can sort of start to objectively analyze it and challenge it, kind of again from a scientific perspective. So we point out that evidence has shown that the sessions will be helpful by kind of first reviewing their week, checking in with them, seeing how things have been since the last time we saw our clients, reviewing some of the homework, if we did give them any homework, and then focusing on the direction of the session. And this is something I think that's kind of common in many types of therapy, but it's that collaborative approach of figuring out what's the focus of today's session, right? What needs to happen in today's session for it to have felt meaningful for you, or for you to feel like leave here feeling like that was worthwhile. So we'll do some check-ins, we'll find out how the week went, we'll focus on any significant events. We will also screen for mood, so just checking in on what their current mood level is like, and then focusing on some of the positive or negative changes that they've noticed since the last session. So that's usually done, again, depending on, I know some of you don't have long with your clients, but typically that's about a 10-minute part of the session. It's not really used as a venting session, but it's more sort of, again, looking at sort of objectively, kind of hearing what happened the last week.
Yeah. I've seen a lot of questions on kind of social media and technology, and I'm wondering if you can share some of your information, kind of some of your experiences, because you have a lot of youth in your sessions that social media plays a big role for
social media does play a big role, and it is something, again, working with teenagers, most of their communication now is done via online things like Snapchat or Instagram or texting. And I would agree with many of the comments here in the chat box that it does sort of significantly affect, one, their interactions, but also their perceptions of certain things. Because I have clients that have come in tears in my office, and I think especially because it's the way that they're communicating, perhaps things like they're inferring tone from, texting or email correspondence. There's often a big jumping to conclusions based on sort of dialogue that they're getting from their phone. So, I've had a client that just came in and she read me this email or message text from her friend, but she read it in this really negative tone, and she said, and the friend didn't leave an emoji, and they didn't, say anything nice afterwards. There was no pleasantries, and they were really upset. But then I kind of came in and I read it with a different tone, and she was like, well, if you read it like that, it's totally different. And it just made me realize that, again, from their perception of things on the phone is very different, I think, than it could be if you were in person. I am seeing that a lot of clients that I work with struggle with in-person communication, because of most of their dialogue and communication being over social media, which is really interesting. And it's interesting to see sort of how that shapes kind of, especially as it relates to social anxiety, I think.
Yeah.
But I notice it. I see a lot.
Yeah, and social media brings so much more kind of complexities to the therapeutic relationship and just kind of in general our world, because people tend to be a little bit meaner when they're hiding behind a screen, right? So the comments that people receive on pictures on Instagram or, with Twitter, people are a little bit, there's online bullying everywhere now. And so being mindful of that and, knowing that what happens in social media, we can bring that into the session as well and look at how we can filter that information as well.
I also think it's just an interesting way of communicating,
It is,
right?
yeah.
And so even things like, because it's so instant, even things like when somebody doesn't reply to you in a certain amount of time, I think, again, from a cognitive distortion piece, that is often one of the most anxiety-provoking situations that many people have, because it creates all of these, I did something wrong, did I say something wrong, I should have said this, and where did they go, and they don't like me anymore. And it's, again, that's something that we don't necessarily get when we're communicating in person.
Absolutely.
Yeah.
Gary makes a really good point. He says technology can be seen as a double-edged sword because many of your clients use Facebook, let's say, announcing they've quit smoking, and they gain support from their friends and maybe even encourage others to quit as well.
Totally.
So, yeah, that's a great point.
And it is something that we actually do as clinicians encourage, too, the use of technology, using things like Smokers Helpline and some of the quit apps and things like that, and some of the texting. So you're right. I know it's definitely not all bad, but I think it's just creating that awareness.
Absolutely. Absolutely. So we can think about, again, in just kind of typical CBT sessions, and, there's different ways of implementing CBT. You can kind of follow, the probe step by step, but then you could also use a little bit more of an eclectic approach and bring different techniques into your sessions in general, right? And so the one thing we want to do is kind of work together and work concurrently to create an agenda for the session. So, goal setting together, kind of focusing on kind of what the biggest thing that the client wants to work on. And that really just highlights that client-focused approach and really just ensures that collaborative or that partnership together. There's lots of really great behavioral activities that really comprise CBT in general. Thought records, which are kind of these recordings that clients can do on a weekly basis, where they identify some of their thoughts, maybe some of those thinking distortions, some of their what we call hot thoughts, which kind of lead to some of those core beliefs, some of their activity schedules. They can just kind of focus on goal setting. And so we've added a link there where you can utilize some of the worksheets as well. Different types of questioning. So we call it Socratic questioning, which is utilized during kind of CBT sessions to really elicit some thoughtful responses from our clients. And we have some examples as well that we've included for you. I just want to give a plug to our favorite book, Mind Over Mood.
Yeah.
We both really love the workbook Mind Over Mood, which is CBT in nature. It's used for mood, so it's used generally for anxiety and depression as well. And it's a really great workbook for clients to be able to work through kind of at their own pace or kind of concurrently with treatment. They also have a really great clinician's guide, so you can use it in conjunction. And so we find that that's a really great workbook that you can utilize a lot of these examples from, or a lot of these activities from.
And Mark is asking, actually, if we have a standardized CBT group layout that you follow. I'm wondering if some of your group work.
Yeah.
You've run some CBT focus groups.
I've run CBT groups before, more motivational interviewing with CBT, so it's a little bit more of an eclectic MI CBT group. It's not standardized, but we'll share information, and I can definitely share kind of what that looked like. Not much different from individual sessions, and we just kind of work together on a lot of these activities in a group, and then there is a homework component as well, but we can definitely try and share. I can share some of the experiences that I've had with some of the group work that I've done before.
And I'm even thinking with Mind Over Mood, I mean, I've used that in inpatient psychiatry in group format, right? And so it lends itself, again, these sort of standardized activities, and then people complete them individually. and then we'll actually take them up as a group and review it as a group. So that's worked really well also, is having everybody kind of work on one workbook. And then going over those particular homework items.
And great to see the Nicotine Dependence Clinic has also developed a new client workbook for managing mood, and the link is there, so way to go, Teach. And Helen says Mind Over Mood is available at Chapters, and it's very good. Yeah, we love that. It is, and I think on Amazon sometimes too. Sometimes it's cheaper on Amazon.
So. The nice thing with Mind Over Mood too is you can purchase the clinician guide as well, which sort of gives kind of nice tips and tricks and strategies for the clinician to help you guide your clients through using Mind Over Mood and how to actually use it instead of just sort of giving it to your client. There's also a little teach part for you as well, which is great.
So moving on to some more specific cognitive interventions, kind of different things that we work on. So cognitive probes, which is kind of one of the techniques that we use, and what we would do is work with our client and have our client just kind of visualize or imagining that currently an upsetting event is happening, and really working through some of those clients' thoughts. And it allows our clients in a safe place to start to identify some of their automatic thoughts that they're experiencing. And it allows us to then really catch that thought process. And then we write it down. So then we can actually start to review those processes and really start to see some of those schemas as well. The thought record is really helpful. And what I find generally when I start seeing clients is we'll do a cognitive probe together, either just imagining the upsetting event or just exploring kind of the most recent upsetting event, just kind of looking back on it, and then work through a thought record, kind of one section of the thought record together or one entry, and then have the clients kind of do that thought record 2 or 3 times in a week, or if they want to, they can kind of follow through every single day of the week. But, being able to really start to see some of those patterns and some of those thinking processes that occur in a client's life.
Yeah, I like to, as a strategy sometimes, and in our office that we share, we have a whiteboard. And so sometimes based on how the client, a certain thought, I'll have them share it with me and we'll put it up on the whiteboard, and then we'll kind of branch off all of these alternate thoughts or other ways or how that thought has made them feel. And I love doing the visual part of it because sometimes it's one thing to feel it, I think, inside your body, the thoughts that you're having, but it's a whole other thing sometimes to take it physically out of here and put it kind of on a wall. Yeah. And so I really love that as a technique because you get to recognize, okay, whoa, that's a lot that I'm feeling inside. Or you start to make those associations that, hey, that particular thought led to a lot of other negative thoughts, which led to a whole bunch of negative feelings, or I didn't like how that felt in me. Or sometimes we'll also use like construction paper, and we've done this one before, and we'll write it down, and then we'll just put them all around the room. And again, it's just a really good particularly for visual learners, to be able to see all those thoughts kind of out of their mind in the office.
Absolutely. So schema change methods really, again, just a fancy word for looking at certain thinking strategies. So really what they do is they test the validity of the automatic thoughts and really start to challenge some of those core beliefs. And clients really start to review the evidence for and against each schema or each core belief, and we want to ask the following questions. So, if someone has more of a core belief that tends to skew a little bit negative, we want to know if the thoughts are helpful. We want to know and start to identify some of the cognitive distortions that might be present. We want to know if the thoughts are consistent with evidence, and we always like to highlight kind of evidence is facts, right? We want to use kind of the evidence. We want to make sure that it's actually a fact and not just, exactly. What's the proof for this thought? Looking at all the alternative explanations. This is one of my favorite things to do, is have our clients kind of really start to reflect on what would they say to a friend in this situation. So often, if asked to help ourselves or asked to kind of look inside ourselves or, focus on challenging our thoughts, we kind of come up with nothing. And so often with clients, they'll come up with so what do you think? And we'll go through some of these and they feel a little bit like, I got nothing for you, Steph. And then I'll say, so let's just pretend your friend is sitting in here, and we'll kind of pick a friend's name. Let's go with Carolyn. Let's say Carolyn was sitting in this chair here. And let's say Carolyn was going through this situation and kind of map out the situation. And then I say, what would you say to Carolyn in this situation? And then the words keep coming out. They're just going, right? Well, I would do this and this and this and this. And oftentimes, the information that they're giving Carolyn does not contain any negative core beliefs. It's very balanced thinking. And so, so often it's so much easier for us to kind of look outside of ourselves to be able to kind of challenge those core beliefs. So I find that's really helpful. And then also starting to see kind of where we learned to think this way and kind of what has impacted our thinking. I always use this backpack analogy. For any of you who've been on a webinar with me, I think I've used it many times.
I love it.
But the backpack analogy is that we've been born with a backpack. We're all kind of born with a backpack, and our life experiences and kind of things that we've been taught really all goes into that backpack. And pretty much the way that we see the world is in this backpack. And a big unzipping the backpack, putting the contents on the table, and really starting to explore what's in that backpack. Because once we see what's in that backpack, that might be impacting some of our core beliefs and the development of some of our core beliefs.
I love that question of do you still need to be carrying that particular thing in your backpack anymore? Is it helping you? And often that question of, is it helpful? I also ask my clients too, is this a helpful thought? Right? And just again, getting them to be content. Things that we want to keep in mind. I think many of us have heard this, starting at the level that the client is at, and sort of basing it on their, and that really we want to start with smaller goals, and this is very kind of in keeping with the intentional approach as well, is starting with goals, and then slowly kind of making our way up to the larger goals. Of course, we want to anticipate obstacles as well and help the clients to decide how to deal with each potential obstacle. And those are always important because the obstacles are what can kind of derail a particular goal. And so it's good to strategize on how we might handle that if we encounter it. Mm-hmm. And again, there's the homework component. So clients are really taught to start to monitor their thinking. It's really all about, and that's when we will shift into mindfulness, but it's about shifting into how do you think? Slowing down, being aware of what that dialogue is that's going on in our minds, and looking at really that connection of, hey, when I think this thought, I don't feel well, or how does it make me feel? And then if I'm feeling a certain way, how does that affect how I might kind of go about my day or my behaviors and my actions? And then how to really identify, maybe I am kind of catastrophizing right now, or maybe I am, doing some all or nothing thinking or some black and white thinking. And so we get them to start to analyze their beliefs again, really with a scientific approach. And then, as Stephanie was saying, the other part is to get them to start changing those beliefs into more realistic thoughts or alternative ways of thinking. And often the way I start this with clients is I say, just say to yourself, once you start to become aware of these thoughts, say to yourself the opposite thought. You don't have to believe it. You don't have to, anything like that, but it's just getting your brain to shift to an alternative way of thinking. Mm-hmm. The more that you do that over time, the more that you're going to start to automatically do that and maybe start to shift that, hey, everything is not always black and white. Maybe there is this gray area or a different way of looking at something.
Yeah, definitely. I also want to highlight just the fact that CBT, it takes a lot of work, right? In order to kind of change the way we think and change our automatic thought patterns, it takes work on behalf of the client, and it takes time. And so sometimes something I always use, kind of this analogy, as you can tell I like analogies, an analogy that I use with my clients is that think about, how long have they been thinking this way? So has it been 15 years, 20 years, 30 years? And so, your brain is almost like a big field that there's been a big snowfall. And so let's pretend that there's this one trail where the snow has been kind of cleared away because people have walked through that trail. And so that's oftentimes where everyone's drawn to, right? That's where we're drawn to because it's easier to kind of get through. There's no snow, it's just kind of fast, and that's where we go. What we're doing right now is we're creating a new trail. And so it's hard, right? It takes some awareness to even decide that you are going to take that new trail. And it's tough to kind of trudge through the cold and the wet snow. But what it does is eventually the more that you take that new trail, the easier and easier it's going to get, and it's going to become automatic. And I always say to my clients, we're building new neural pathways, and it's very exciting. And so just be mindful of that, and just be aware of the fact that it does take work, and you are going to go back into that automatic thought pattern, and that's okay. That's okay. We'll get there.
I love that, and that's often, you're right, Gary, right? That's neuroplasticity, creating a trail or a ditch.
Yeah.
So shifting a little bit now into applying some of this to smoking cessation, is how do you think you could utilize some of these techniques in your next smoking cessation visit with your client?
So while you're thinking about that, and again, you can put it into the chat box, or you can even just put a little note for yourself, because that's the most important thing, is that you come up with something that you can maybe try in some of your own sessions. Shall we move on to mindfulness? We're going to do it. Okay, so we're going to talk a little bit about mindfulness as well. And obviously, we're both very passionate about mindfulness, considering that we're opening up a mindfulness space. But really, when we think about the definition of mindfulness, Jon Kabat-Zinn has really done a ton of work. I always call him like the rock star of the mindfulness world. And something that he has said quite often is paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And mindfulness really is that. It's just purposefully paying attention to what's going on and staying in our present moment. And the non-judgmental piece is that so often with our thoughts, and why mindfulness and CBT go so well together, and why it's so helpful for therapy, is that so often when we have thoughts, we include emotions with them. Those thoughts come with feelings. And so being able to experience thoughts and try and take away some of those emotional reactions can really help us to start to regulate some of our emotions, or start to detach ourselves from every thought that comes through. Because we just explored, not every thought is true.
That's true.
So there's a couple different types of mindfulness-based therapies, and again, this is just kind of an overview. We will share with everyone. We'll have Teach send out a bunch of information on ways that you can get extra certifications in both mindfulness-based stress reduction and mindfulness-based cognitive therapy. But MBSR, mindfulness-based stress reduction, really just allows individuals to really learn how to deal with stressful situations and the circumstances in their life. It can be used in a group format. It can also be used individually. And really what it does is, even while people are undergoing serious difficulties in their life or serious challenges in their life, it really allows our individuals to start to relieve that internal conflict and that internal struggle that's going through their mind. And so there's MBSR programs kind of for everything. There's chronic pain, serious illness, anxiety, panic, for those with high blood pressure, for heart disease, for those living with stressful homes. And that really came out from Jon Kabat-Zinn. It was kind of coined by Jon Kabat-Zinn. He created it in the University of Massachusetts as part of it came out of the medical model. It came out of some medical interventions. And then we've since then moved it into the therapy world. Do you want to take this one, or should I?
Yeah, you can keep
going. Okay. Mindfulness-based cognitive therapy was created by, quite a few, you can do that last point, but Zindel Siegel is really kind of the forefront of mindfulness-based cognitive therapy, and which is always exciting because he's out of Toronto, which always makes me really happy. And BCT is kind of like, I always like to kind of call it the love child of CBT and mindfulness. Yeah. And so it was originally created as a method to prevent relapse for individuals with serious depression. And really what it did was it taught clients, or it taught individuals to start to relate differently to the thoughts and the emotional states and the physical sensations that kind of preceded a full-blown depressive episode. So it had this component, of mindfulness to really start to identify what those emotional states are, what those physical sensations are, what the thoughts were that they were having, start to identify some of those automatic thoughts, and also be mindful and start to feel those automatic thoughts to be able to start to see kind of where things were going, and then be able to prevent a full-blown depressive episode from happening. And then really the belief was that it could prevent that reoccurrence of depression. We found that it's now very useful for individuals with bipolar disorder, anxiety disorders, and major depressive disorder as well. We also know that mindfulness is very useful for the treatment of substance abuse, and also as part of aftercare to prevent relapse. There's something called mindfulness-based relapse prevention, and you can read a lot more about that. But, you know, thinking about, like, when I've done smoking cessation work, like up until December, I was still seeing clients primarily for smoking cessation and running groups. And I brought mindfulness into pretty much every single session because it really allowed our clients to, you know, start to see those thoughts that you know, triggered someone to start to smoke, or triggered someone to feel a certain way that then they would want to slip, or they would want to relapse and smoke again. And so it really allowed individuals to process their emotional state during treatment. And again, like I said before, kind of taking that emotion away from it. And then also starts to remove the power of the emotions that can be quite triggering and can lead to craving. And so mindfulness is really useful as an adjunct to all treatment modalities. I have another analogy, but something I do. No surprise there. But I often say to my clients, you know, when I'm promoting mindfulness, or when I'm kind of introducing it, because not everyone's into it. Yeah. And I always say to people, you know, mindfulness, and I'll give my spiel about what mindfulness is, and I'll say, like, sometimes to some people it can feel really fluffy, but, you know, there's a ton of research around it, and we're going to go over some of the research, but I name some of it. I say, you know, if I don't even just introduce this to you, or if we don't even just try it, I feel like I'd be a bad therapist in a way, right? Like, it because of the research, let's give it a shot. And so most clients are open to at least giving it a shot, and many do love it. And so I find it helpful to either, you know, there's lots of apps that we can utilize, and we'll talk about some of those, but even you can still get, like, mindfulness CDs or DVDs that people, if they don't have access to a smartphone or an app or the website, they'll be able to utilize different types of mindfulness.
That's what's nice. It's becoming so accessible to so many people. And I know even I was just on a long haul flight, and they had, like, on the
I love that.
in the plane now you can listen to a variety of different, like, mindful and meditation practices sort of on the plane. So that just highlighted to me, I think, one is how widespread it's becoming. But a lot of that, as Stephanie mentioned, is really because of such the strong research and the literature behind it that really supports its benefit, again, not just in substance use and in mental health, but also in overall health and wellness as a whole. And this is really just kind of leading now into some of that clinical research. And I think, again, it speaks for itself. I mean, there's tens of thousands now of published literature, really good clinically published literature out there that does support the benefits of mindfulness just in the realm of health overall. Things like increasing brainwave activity. You know, I think that was something that you were at a talk where they spoke about that, about increasing gray matter in your mind, and just, I mean, that's something that they actually can show.
Yeah.
Right?
I find that so exciting.
Yeah.
It makes us smarter.
Right?
Great.
It makes us smarter. But when we can actually see that on a scan, that gray matter increases based on because we've been doing mindfulness practice. We're showing that seeing an increase now in compassion and empathy in those that practice mindfulness on a regular basis. Better mastery over our emotions. So this is something that, again, we're seeing coming into a lot of, like, DBT type of programs, people who get dysregulated emotionally. Again, mindfulness now is really coming in as a way of learning how to help with emotional regulation. And so that's something that, again, is really beneficial for many people. Increasing our parasympathetic nervous system. So this is the part of our body that is involved in sort of our rest and digest kind of system. It's a part of our system that gets activated during yoga, during sleep, but we also can activate it during meditation and during mindfulness. And this really helps because sympathetic activation, nervous system activation, is kind of that fight or flight response. We see that particularly in a lot of people with anxiety, is they're kind of in this hyperactive sort of stimulated state. And so we need to be able to bring that down, or help the person rest, bring down their adrenaline levels and their cortisol levels. And one of the ways to do this is with mindfulness. And so there's been really huge strides, again, in using mindfulness as a stress reduction technique and as a way of calming our physical system. And because of that impact on the physical system, we are also seeing it being used to help actually decrease blood pressure, which is, again, really interesting. And you're seeing studies that are finding, 4-point decrease, and people who are shifting off of medications because of the impact that they've been able to have with meditation and mindfulness practice. So really powerful.
What excites me so much about mindfulness is that it doesn't take so much time, right? So the study that we found in 12% increase in gray matter, they were practicing mindfulness for 20 minutes a day. And that's not a lot in a day, right? And for people who are busy, 20 minutes seems like a long time, but even 10 minutes, right? Even being able to be still for 10 minutes a day, we see so many positive benefits. And I think that's what excites me so much. Like if someone said to me, you'll get all of this if you just kind of invest 10 minutes a day in doing this, it seems almost too good to be true. But the research is showing us that it's not too good to be true. And again, just kind of continuing on with the clinical research, we see, physicality, the decreased risk of heart disease. We see the reduction of cortisol, which is that stress hormone. Being able to see that increased blood flow to the brain will decrease anxiety and can increase memory. It can help with chronic pain, which is really great. There's a lot of fantastic pain programs that are utilizing mindfulness, especially back pain, because back pain is the biggest chronic pain concern in Canada right now, or in Ontario. And so being able to utilize it to actually help with back pain, which is, cripples a lot of people, is really exciting. Seeing clinically significant findings for the reduction of generalized anxiety disorder, and then also as an adjunct for the treatment of grief and trauma is really great as well. Can you take this on for you?
Yeah, so then also, again, self-care for therapists and clinicians. So it's also really helpful for us, and that I think is also sort of the benefit is that mindfulness is not just something that we should encourage or ask our clients to do, but it's also something that we as clinicians actively practice because the literature, again, also supports that it does help relieve burnout and like compassion fatigue and vicarious trauma. And so that's really important as well, is that, again, if we're going to be taking care, helping others, that we also take care and help ourselves. And so we see that mindfulness, and when the studies have looked at the use of mindfulness on clinicians, it actually increases the efficacy of the work that we're doing. It helps to increase our own empathy and compassion for the clients that we're working with. And again, because of the effect it has on emotional regulation, it helps us to be able to deal with stressful situations a bit better and kind of help to improve really our professional and personal resiliency as well. And so I think just overall when it comes to our self-care, it's a really great strategy to incorporate for ourselves.
For sure. We had a question. Ravinder said, was the 20 minutes continuous or could it be split up through the day? So the study that cited the gray matter, it was continuous, but we do know with the many, tens of thousands other studies that came up, the 10 minutes is very effective. So just 10 minutes on its own is very effective. So it's kind of like, the more you do, the better, but, don't overdo it because 10 minutes really has strong benefits as well. So that study itself was 20 minutes, not continuously, but again, we're seeing massive benefits for 10 minutes at a time. And Gary also highlighted, he said, wherever you go, there you are, which is a really great book by John Kabat-Zinn. Yeah. So if you want to read more about mindfulness, highly recommend picking up that one as well.
I say that quote to my clients all the time.
Yeah. And everyone's sharing, some resources in the chat. So if you're not looking at the chat, you want to go there because there's some fantastic links as well.
That's really awesome.
So we wanted to leave you with a couple take-home activities or take-home challenges if you want to continue to kind of solidify some of your learning. So maybe today or kind of within the next week, take some time to identify one of your own thinking distortions and maybe come up with a plan to challenge it yourself over the next 2 weeks, because we all have thinking distortions.
We do.
And so being able to, practice what we preach is so important when we're clinicians. So being able to try doing that ourselves. There's a couple of different apps. So I personally love the Insight Timer app because it's completely free. Calm.com.
Calm is one of my favorite. Yeah. That's my favorite one.
Calm also has an app. Headspace also has an app, but you have to pay for it after the trial. But maybe for the next week, try to meditate for 10 minutes a day using using one of the apps. And maybe if you can, make a goal for yourself to try and bring one of these therapies into your smoking cessation practice. What I find really helpful when I'm kind of amassing new learning and new techniques is I'll go through my calendar and kind of put little checkpoints over the next couple months to try and, check in with myself to see if I'm still on track with some of the, implementation of some of the different therapies. Because I find so often we're very excited after we leave a webinar or after we leave a training, and then after a while, after a couple days, we get back into the grind and we kind of get into old techniques. And so being able to have those visual reminders are often really, really helpful for us as well.
The other is I would encourage you to maybe even try one of them with your clients. So that's something I like to actually do with clients in the office, is sometimes to put on an app, because sometimes just to tell a client to download an app, they may not always follow through with it. So if we actually do it in the office together and do a quick little practice, I find that can really kind of solidify that learning as well for the client, and maybe encourage them a little bit more to do it together, or to do it kind of outside of the office. So that's something I would also encourage to see what your clients think. You can download some scripts as well, and so you can actually, read out a meditation for your clients, or there's tons of little mindfulness activities that you can come up with as well. So we would encourage you to do some of those take-home activities.
Well, thank you, everyone, for a great hour. We have a minute left, so if there's any questions, we'll keep an eye on the chat box. But if not, teacher will be happy to save or share our information, and you can always keep in touch with us.
Okay, thank you guys so much. I thought that presentation was wonderful. I love that, it wasn't just about smoking cessation. You talked about a lot of ways these techniques could help with co-occurring depression, anxiety, addiction.